Straight ahead on Folks, we'll take a look at some very serious health concerns for the black community. First, News Director Rob Hinton brings us a special report on AIDS. Then we'll talk frankly with two physicians about AIDS and other life-threatening diseases on today's edition of Folks. Hello everyone and welcome to Folks. I'm Sonya Masingale. Today's issues are very serious ones relating to health. It has been known for some time that blacks are twice as likely to develop hypertension, which can lead to heart disease and increase the likelihood of strokes. The good news is that studies are showing that most Americans are fighting back through controlling their diets and cholesterol levels. The bad news is that there's been little measurable change in the diets and health habits of American blacks. We're going to take a look at some of the reasons why and some practical ideas for fighting heart disease and high blood pressure later on in the show. But first, we'll take a look at a dreaded disease which is steadily taking hold in the black community. AIDS, or acquired immune deficiency syndrome, is a virus which impairs the body's ability to fight disease. In Louisiana, 299 cases of AIDS were reported in the fall of 1986. Of those cases, 26% were black. So you see, the black community at large has an obligation to learn more about the AIDS virus. Recently, Rob Hinton sat in on a conference on AIDS and substance abuse in the black community.
A lot has been said and written about AIDS over the past year. Too often, AIDS is mistaken as a gay disease. But the fact is, anyone can get AIDS if they're not careful. In this country, 25% of all people with AIDS are black. That's 1 out of 4. And 6 out of 10 children with AIDS are black. AIDS is definitely a serious health threat in the black community.
People don't realize how serious this disease is.
That's Frederick Garnett. Garnett is a staff psychologist at a Washington, D.C. hospital and a Ph.D. candidate in clinical psychology. About a year and a half ago, he was told he has AIDS.
In many ways, I'm not a typical person with AIDS, or PWA as we often use the terminology. My health has been relatively stable. I still work full-time. I enjoy outside activities, and my stamina is fairly good. But I don't fool myself. My condition is serious, and in many ways it's illustrative of the similar conditions going on in the black community, both here and elsewhere.
At a symposium on AIDS in the black community, Garnett talked candidly about his life since being diagnosed with AIDS.
In the year and a half since my diagnosis, I've undergone a lot of changes, the depths of which I could have never comprehended. I've seen my health seesaw. I've seen my mind go from the heights of understanding to the brink of despair and back again. I've seen some relationships flourish, and I've seen others wither away. And I've seen a lot of people die. But you know, for all the anguish and the senseless death, I still have hope.
But before hope, Garnett said he experienced a lot of fear. Fear he has since overcome.
I learned to stop fearing my own death. Now, personally, I don't plan to die from AIDS, okay? But I accept that we all die, and that sooner or later I will die. And if it is from AIDS, then so be it. Because, you know, one of the things I'm happy about is I feel like I know I've led a life worth living. And I don't think that's any more than I can ask for. I also refuse to be ashamed of having AIDS. I know that it's a disease, and it's not a sign of some sin against God. I know that it's not God's punishment to me for the life I've lived, because I know that my God loves me. I know that my God is caring and not punishing. And my God knows that I have love in my heart for myself and others, and that I feel other people's love in return.
Garnett said his medical expenses so far have totaled nearly $100,000. He also said that people just don't realize how devastating AIDS really is.
They are rolling them in the bigger cities now, in the public health departments, the public hospitals. The public hospitals in places like New York and Chicago and Los Angeles and D.C. is getting that way now too, and it's a small town, San Francisco. These people are coming in there in droves, increasingly. The rates of people being tested positive in poor communities, in black communities, and drug abuse communities are starting to go through the roof.
There is no cure for AIDS, but Garnett says AIDS education can keep the disease from growing.
We have to get our black professional communities involved with AIDS, black nurses, black doctors, black psychologists, black social workers, black teachers, black educators, any kind of professional group. They need to be knowing more about AIDS and need to be pushing this. These people need to be supporting it. Now, of course, the churches need to be supporting this kind of stuff. And they're just not getting on that bandwagon very fast.
Remember, you don't get AIDS from toilet seats or water fountains. You don't get AIDS if you go to school with or work with someone with AIDS. You don't get AIDS by hugging or touching someone with AIDS. You get AIDS by exchanging body fluids with your sexual or drug-using partner.
Joining me in the studio today to talk about AIDS and other health concerns in the black community are two distinguished physicians, Dr. Victor Jackson, a specialist in internal medicine, and Dr. Luther Stewart, a specialist in primary care and anesthesiology. Welcome to folks. I'm glad you could be here.
Thank you.
AIDS is such a frightening and devastating disease that many people would rather bury themselves in the sand than to deal with the reality of it. But some researchers are saying that certain people in the black community are at an even higher risk of developing AIDS than some other people. Why is that? What does it all mean?
First of all, let's define the risk factors for AIDS. Okay. The higher risk groups has been proved to be the homosexual male. The second highest risk group has proven to be the IV drug user. Those two combined, a homosexual who's also an IV drug user, has a much higher percentage than any other person to catch AIDS. Then there's also been some studies to show that 5% of the population who are hemophiliacs who receive blood products also have about a 5% chance of catching AIDS, depending on the amount of blood products that they receive. Mm-hmm. And also about 4% of the other AIDS victims have been proven to be just straight heterosexuals. So,
who probably got AIDS through sexual contact.
As well as the reporting data is not exactly sure if they are actually bisexuals as well.
Do you always die from AIDS, Luther?
The excuse me, sorry. The figures are very disheartening. As of November of 1985, the total number of cases of AIDS reported at that time was estimated to be about 8,000. As of November of 86, the total number of figures was estimated at 27,800. 50% of this 27,000 figure has succumbed to the infection of AIDS. Mm-hmm. The figures are alarming, and they are a reason for concern among the health officials in this country.
There's so much we don't know about this disease, and yet what is this flack about black people being more likely to get AIDS? I don't understand.
Any communicable disease, the black population is going to be at a higher risk, number one.
Why?
For instance, tuberculosis back in the 20s and 30s, the black population is a much higher risk back then, as well as syphilis. The main thing, number one, is probably because of how they're mostly are clustered together in the urban areas. Number two, it's probably because of not being aware of preventive measures that they can do to help decrease their possibilities of catching the disease. Number three is obviously the access to medical help. Okay.
And as Dr. Jackson has pointed out, the socioeconomic factors in any disease is very important. The less you know about a particular medical problem, the more susceptible you are to this particular disease. The problem that exists in the black community in that figure is a very alarming figure in the sense that disease does not retain itself, nor does it tend to follow racial lines. The fact that it tends to be higher in the black community only means that it's indicative of the risk groups in this community, and that the other groups in the country at large will be at just a greater risk because of the smaller number of the black community eventually spilling over into the larger number of the country as a whole. So we can't really look at any disease as a particularly racial pattern because disease simply does not follow any racial pattern. It is simply clustered and it will spread.
I see. Okay. What does AIDS look like? How do you know you have it?
First of all, AIDS itself is not the disease that kills you. AIDS, what it does is decrease your immune response, the ability to fight off the disease. And you end up usually dying of what we call an opportunistic infection, something that a normal person's body immune system is able to fight off. Some of the early symptoms that you can develop when you are possibly infected with the AIDS virus is weight loss, diarrhea, lymph node enlargements, fever, and loss of appetite. And if you have any of those symptoms, probably the best thing to do is go to a physician and let them do a blood test on you and see if you are infected with the AIDS virus. The death certificate, when people die with AIDS, does not list AIDS as the immediate cause of death. They usually die with some form of pneumonia, which is rare, a rare form of pneumonia that normal people do not develop. Usually only people on chemotherapy or people who have a form of decreased immune response usually die of those types of pneumonias and other little opportunistic infections we call.
I noticed that in Rob's piece, the young man with the AIDS looked as if he had extremely bad acne. Is that also one of the symptoms?
The cutaneous manifestation of AIDS can be rather profound. Up to 70% of people with a definite diagnosis of AIDS will develop lesions on the skin known as Kaposi's sarcoma. However, Kaposi's sarcoma is also found in other conditions as well. It's just that in patients who are infected with the AIDS virus and develop the syndrome, the incidence of this particular lesion is found to a greater extent.
Is it always on the face?
It is localized on various parts of the body. No, it's not always on the face.
So it can be on the back, on your legs?
Yes, just any place where there is a cluster of vascular tissue at a closer level to the epidermis or the natural skin layer. It's also found in organs inside of the body as well as on the outside of the body.
Okay. What can we do to prevent it? I mean, what's going to stem the flow of AIDS in the black community?
In any community, lifestyle changes is the ultimate answer, I believe. IV drug users being at a higher risk, homosexuals, changing the lifestyle patterns is probably going to be the thing that prevents anyone from developing AIDS at this time. There's a lot of medications on the market which they're doing research on in terms of stemming off the complications that follow with AIDS. But presently, right now, the only thing that we can do is decrease your risk factors by changes in your lifestyle.
Does that include heterosexual people?
Being extremely selective in terms of your sexual partners, obviously, as well as using condoms in terms of avoiding skin-to-skin contact.
Okay, I have a question for both of you since you're physicians. Would you recommend that all members of community go for screening of their blood, go for the blood test?
My answer to that is yes and no. Since there is no cure for AIDS, the best possible way of preventing it now is education. And herein, this is where the instances of condoms come in. Condoms by themselves will not prevent the spread, but condoms in association with a generalized education, public awareness can indeed curtail the disease. The situation that generally develops is not knowing the means of infection, how it's spread, makes all of us susceptible. If we can institute testing on the width and breadth of the black community as well as this country, then it would probably be a good idea as long as that individual's rights are protected and privacy is maintained. However, if we are not able to ensure the rights and privacy of individuals testing positive, then the results could have more damaging effect than beneficial.
The initial screen is very expensive, though. I mean, what's it going to take? I mean, at least $100. What is it going to take to make that more available to people?
Well worth it, though. Well worth it. Basically, I'm presently only an advocate of screening for partners that are planning to get married and other higher risk groups, possibly people in hospitals. And then the biggest thing is guarantee their privacy. Anytime that you will start some broad spectrum screening of the general population, and the blood test rates will go down, I believe.
And the tests are not, the screening tests are not diagnostic. There are false positives and false negatives with the blood test, so that there is no absolute guarantee that if you test positive, you have been exposed to the virus, and if you test negative, you have not been exposed to the virus. This is why it becomes medically important to leave these decisions more or less in the realm of experts who know how to handle them and interpret them. Again, I have to emphasize that the test only indicates exposure. We do have testing at a very large scale now, and that is in the blood banks, and that is simply to eliminate blood being used as donors for patients receiving blood. It in and of itself does not have any diagnostic value. It just disallows this particular blood to be put into the pool of blood used for donors.
So one way of getting around the cost of the initial screening might be to donate blood. Would they inform you after that?
They do inform you if several positive tests come out when you donate your blood, such as hepatitis. And usually what they do is send you a letter and tell you to contact your family physician because you had a positive blood test in this particular area. It does not really specify a disease entity at that time, and it's up to the patient to go for further testing and his family physician. Positive AIDS antibody does not necessarily mean that you have the active disease right then. We must clarify that. Okay. There's probably about 1.5 million Americans with a positive AIDS antibody HTLV3 test right now. And usually within 3 to 5 years, those patients will develop outright AIDS.
Okay, moving along. I promised at the head of the show that we'd talk about some other things. There have been some reports released saying that overall Americans are reducing their risks to certain diseases that can be controlled by diet and health habits, such as heart disease, hypertension, and cancer, certain types of cancer that it's thought they can be controlled by diet. But the bad news is that black Americans are not changing their health habits, that they're pessimistic about diet controlling any sort of illness. And why is that?
I wouldn't say they're exactly pessimistic. I believe probably the information is just taking longer to fall down to the black population. The biggest thing in terms of hypertension and controlling cholesterol problems is lifestyle changes again. And I think if the information gets out to the black community that this is their #1 killer, and that they can do something about it, I think they will be able to do it adequately.
Yeah, in spite of AIDS, heart disease is still the #1 killer of all people.
Right.
I think one of the things that we have to bear in mind in dealing with any topic such as cholesterol and hypertension in the black community and how it affects us primarily, and that is it has to be brought to a conscious level of concern. Once it's put there, then it has to be continuously reinforced and expounded so that we maintain our vigilance in screening for it. Cholesterol in and of itself is important, but there are other things associated with cholesterol that are just as important or even more important, such as triglycerides. And some studies are indicating that triglyceride plays as much or even more of a factor in determining cardiovascular disease as cholesterol. We do have drugs that are being developed now for cholesterol, but I think treatment without education and without changing the lifestyles associated with the conditions that produce hypercholesterolemia or elevated cholesterol in the blood is not going to be very effective. There has to be a general pattern of education, diet change, and lifestyle.
Okay, this one's for you, Dr. Jackson. Practically, how can we go about changing our habits? How can you make soul food less fattening or incorporate exercise into a schedule that just doesn't have that much extra time to go run around the block in jogging shoes?
Very good question, and that's just a major dilemma in taking care of patients. I find the most motivated patient is the patient that just had his heart attack. He's willing to do anything to change his risk for having that second heart attack. He's happy to have that second chance. If we can get these patients prior to their heart attacks, or even show them a patient that just had a stroke or heart attack, and to let him talk to the other patients, maybe that would motivate them more. There are several risk factors for heart attack and cardiovascular and hypertensive embolic phenomena, strokes. Number one is hypertension. Number two is diabetes mellitus. Number three is a risk factor of a strong family history. Number four is increased cholesterol in your blood. And out of those four risk factors, including probably smoking, which would be the fifth one, out of those five risk factors, four of those you can change yourself. The only one you have no control over is the family history of heart disease or high blood pressure. The other four you can change yourself. You can get your blood pressure checked and lower it with medication and a low-salt diet. The smoking, you can stop smoking or decrease it considerably. The cholesterol problem, you can change with diet and exercise. So you can have some effect on determining your fate with diseases.
Okay, so when you say diet, I realize that you're not a nutritionist, but you're a doctor, you know everything. How can you actually cut back on the amount of fat? I mean,
just
if you
some generals, number one. When we talked about soul food, it's red meats. Red meats have a high incidence of cholesterol in it. We are emphasizing fish and chicken. We found studies that the Eskimos who eat a lot of fish, which has a lot of forms of cholesterol, but it's a different kind called high-density lipoproteins. That is actually a defense against having heart disease and plaques in your blood vessels. So fish and chicken, and avoiding as much red meat as possible. It's difficult to be off of it completely. Reducing it maybe to twice a week rather than 7 days a week. Decreasing your dairy products and decreasing the cooking oils, the type of cooking oils that you use.
Dr. Stewart, what's the good news?
Well, the good news is that by bringing national issues like this to public concern, we have a better chance of dealing with it. As I had mentioned before, that what we don't know in medicine is frequently the most vicious killer. There are some drugs on the horizon, such as lovastatin, epistatin. These are new drugs that are coming out now to battle hypercholesterolemia. But here again, we have to maintain and remember that it is not the medicine itself. The medicine gives us a chance to change the lifestyle and aid in our own control of either decreasing our exposure to the disease or decreasing the diet that produces the disease, so that there is a great deal of hope on the horizon, both with cholesterol,lemia and, I hate to say, also with AIDS.
Dr. Jackson.
I want to add to the cholesterol problem. Usually with diet, you can lower your cholesterol about 20%. Some people have a much more greater need to lower it more than that. Those are the patients we usually add medications to. Usually the first step in trying to control your cholesterol is just decreasing the type of foods that have a lot of cholesterol in it. And we have to be more conscious of reading labels, you know. And another killer is the hypertension with the salt, and reading about the salt that's in food. We have to be extremely conscious of that. And our population group, it's been lacking with that.
Incidentally, in reducing the cholesterol in the diet, we will also see an amelioration of hypertension as well as diabetes. So that by simply dealing with one particular aspect, we can also aid the treatment and control of two other primary concerns in the black community, hypertension and diabetes mellitus.
Okay.
I found that exercise, one had, also can lower your cholesterol for about 72 hours.
Wow. Thank you very much for being here.
Thank you for having us.
I appreciate it, and I hope the information has helped somebody to get their head out of the sand. We've been talking with Dr. Luther Stewart and Dr. Victor Jackson about health concerns in the black community. And that's it for this week's show. Folks will be off the air for 3 weeks during LPB's Spring Festival membership drive. We're taking a little time off, but we'll be back on March 29th with a brand new edition of Folks. We'd like to close today's program with some of the highlights to come. Internationally acclaimed jazz pianist Joe Sample and the Southern University Jazz Band performing one of the selections from a recent concert in Baton Rouge. See you on March 29th. Bye-bye.